in areas where our resident doctors are staying, and the owners has asked them to vacate the rooms. Such victimization is only because of our poor awareness of the situation. So some of them break down, and they just say that we are not going to work. And there are instances where they have given the resignation also.
You're watching Hindustan Times, and I'm Aditi Prasad. I'm joined by Dr. JugalKishore, the head of community medicine at Safdarjang Hospital. And so there are 5,734 cases in India as of now of positive cases, and there are yesterday there were 540 new patients or new positive cases that were added. This is in stark contrast to not actually very stark, but yes, this is less than the 700 plus cases which were being added over the last 3-4 days. Do you see this as a temporary respite, or something is changing?
Uh, your presumption is good, because the daily fluctuation is expected in any epidemic. It is not always that it is going to be every day some kind of increase would be there, but
Right.
a fluctuation can range from a few percentage to even 10 to 20% fluctuation. So we have to observe over a period of time. Then only we can say that the trend is upward or downward or flat.
Right, sir. But there are some in India, and there are only a few people. The government has, of course, denied community transmission, but there are some who believe that community transmission may have started in India. What is your opinion on this? Especially taking into consideration the state of Maharashtra and the cases that have come up in Dharavi, and where no contact. I mean, a contact tracing may not have been as stringent, or is it stringent? What is your view on this, on community transmission in India?
The government is always, speaking on the basis of facts, and the facts is generated by ICMR, and they have conducted studies and showing that still the infection is not found in the sample which they are doing it. So it cannot be, stated that the community transmission is there on the basis of the facts. As far as the other observation is concerned, yes, you are right that could be there are transmission now happening. It is going to be happen. It is not that we just keep our eyes closed that it is not going to happen,
Right.
because the patients are there in the community and the home quarantines are there. People are moving around. We have seen all over the country the people are not totally in lockdowns.
Adhering to lockdown
Lockdown.
restrictions. Yeah.
So therefore, some kind of contamination and transmission is possible. So we should be prepared for that.
What would you advise? What steps should the government be taking right now to avoid community transmission, if it has not already
Yeah,
started?
more strict education, strict principles of lockdown. Understanding what the government is doing is for the benefit of the population,
Right.
and some of their needs should be handled and tackled by the government. So they are doing it, but maybe more as far as the testing is concerned, because the people are really concerned about that, whether I should be tested or not, and that should be made available. Even the Supreme Court has said that it should be made free. So the government has to move towards that. The testing is one. Another is their food supply, which is concern, major concern.
From what we're hearing so far, the lockdown is likely to be extended, and probably in a more stringent manner, or do you think there is some relaxation that the government might do this time around?
But this is strategy which has been adopted to identify the hot spot and clusters. So that is a good strategy. If we can focus on those areas which are more prone, and lockdown can be done strictly. In other places, some relaxation can be made, so people can do their essential works. So strategically, we have to develop, our policy in that manner. Whatever we observe should according to should be done in that manner.
So far,
Rather than just
right. So far, 73 clusters have been identified, taking off from what you're saying. Now, these 73 clusters across India, not all of them would probably lend themselves to Some of them may be very closely knit clusters and communities where social distancing is not really possible in that sense of the word, or community distancing. What would your advice be to people living in such clusters?
Social distancing is possible within even, yes, you said that in case of the slums, where only one room is there, so it's difficult to separate other people. So
Right.
in that case, the government has always have a provision that these patient can be shifted to some other place in school or nearby, quarantine areas, so they are different, they are separated from the other community member. Such kind of arrangement has to be made, otherwise communication, the community level communication will start, and that would be a little risky.
So I want to talk to you about the rising cases of discrimination against doctors who are treating COVID-19 positive cases. Now, two such doctors from your own hospital have been targeted very recently over the last 1 or 2 days. Now, can you take us through what exactly happened?
uh, we are informing the authorities that there are some instances in areas where our resident doctors are staying, and the owners has asked them to vacate the rooms.
Oh my God.
So it was difficult for our doctors to do the the duties, because that place is very close to our hospital. So that is a one. Another one is, we already know that discrimination is there. The victimization is already there in various news we are finding in Telangana or in nearby of other part of Delhi, and so what I really want to say that such victimization is only because of our poor awareness of the situation. Our population is not fully aware of the condition and position of the their role in the society. uh, it is quite natural whenever you have a threat of your life or your family life, then you behave totally differently, and it is observed not only here but outside India also. And they targets the patient and also to the family members, and sometimes to doctors. And doctors are, because people understand that they come in contact with the patient, therefore they are more prone to have the infection. And there are evidence that the infection can be transmitted to other people from the doctors, if the proper
Right.
precautions. So the community has to take a bigger role, understand, and there the many community leaders, also the politicians and government has to take part into it. The statement goes from the administration, the political leader has to communicate to the population. Then I think such kind of victimization can go down. This kind of risk is always there in all occupation, and doctors are there who are facing brunt of it. Any kind of epidemic, whether it is a Ebola or MERS, or people dying are the nurse and doctors.
Right.
So they that they are at risk, and we should not increase the risk, because the victimization also create a vicious cycle for their psychology and their interest in working. They feel threatened, so they do not able to care the patients. So people must understand this cycle of how this is going to affect the health services of their own.
What is the
Therefore,
sentiment? Yeah. What is the sentiment of the doctors themselves at this point in time? The doctors that you come into contact on a daily basis, and if they're facing victimization, what is the feeling that they have right now, and what would be their appeal to the people?
when when they find that administration is not with them, and also the community is not with them, so some of them break down, and they just say that we are not going to work. And there are instances where they have given the resignation also.
Oh
That
my
is why
God!
the
In this,
government has
okay,
not in our hospital but in otherwise also.
okay,
Therefore the government has brought the notice also that such kind of resignation is not accepted, because this is the emergency, and one should not just say that I don't want to work in the emergency. This
right,
is our job. So such kind of sentiment are there. When they are appreciated, they work more hard. they are, taking more precautions. They're taking care of the patients more. When they are disheartened, when they are victimized, when they are, not treated well, even by family member. I know, how the people behave even in your family, when you are working in. They give various kind of, reactions. Sometimes it's a positive, sometimes it's very negative. So all kinds of things are there, but the doctors are, trained into it. And more, training is required in these areas, where this kind of training is a specialized training. And most of the doctors really do not, this is in some's life, it is first time they are facing the pandemic, you
Exactly.
know
Yeah.
but
The young
other
doctors
senior people
specifically.
we have seen, so they also react in a different way. So this is all, training which is required, and a more practical training and skills trainings are required, where the communications and their mental status, all these has to be inculcated into them.
What
Then
about,
I think,
yeah, 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 please
yeah,
continue.
yeah, that is why, we have started one training program in the communication skills for our young doctors.
I also want to take into account the fact that when these young doctors, when they are, already dealing with this kind of victimization, and when on top of that there is the alleged shortage of protective gear, how are you dealing with that particular thing in your particular hospital?
Yeah, this is very interesting question, and every day the young doctors and particularly those who are working with emergencies are facing daily that they don't have the equipments, and the reports are coming from the major hospital. So government is trying their best, but we know that all over the world we have a problem of the
Right.
PPE.
Yeah.
So that is what our doctors has to be trained in that emergency situations, how you have to innovate and create the opportunity to have the more new things and new ideas which can be implemented immediately. So such situation definitely give rise many opportunity to many people, they come up with. So that should be open, and it is actually the time when you can encourage the young doctors to go ahead and give the freedom to have experiments and innovations in those areas. So definitely when they feel, when they feel that they are valued, in these conditions, then they are receptive to taking the risk. It is not that I have witnessed, I have faced my student, my interns, which said that we will not go to the work just because we don't have the face mask. you know so my simple advice to them, because I am expert in occupational health,
Right.
and I know that putting the mask is not going to help you. A minor, like the minute viruses which can transmit by any face mask which is available, not protective. So why you are creating problem to you? Because when you put the mask, then it is not obstructing the virus to go in, rather it is increasing the virus load in you, because you take breath much heavier. When you put the mask, you just
You're breathing
observe
more heavy.
that
Yeah.
your, huh, your breath become heavier, and you are risking yourself more. So in situation where you are dealing with COVID positive patient, or patient who has the sign and symptom, require the mask. I give one simple example to my student, that why we put the surgical mask. It is for the patient or it is for the doctors for whom
Hmm.
it is there.
Hmm.
So then they realize, they said yes, it is for the patient, because the surgeon is putting the mask, not for self. It is for the patient, because he can speak, he can talk, and in that talk, the droplet should not go into
Should
the
not.
surgery.
Right.
you know so that is why he's putting. It is not to safeguard self. So then they realize, yet yes, the me is right, and that is why they accepted, okay, fine. When they are working in our health center, there the patients are, not many, may not be there, so one should not require any mask. everybody on the, in the community do not require mask. Unfortunately, it is created just because of, misinformation, and that is why there are a lot of panic and hoarding of the equipment has occurred. So right information and right way, can definitely, solve the problem.
Thank you so much for your time, sir,
Thank
and
you.
we
Thank
look
you.
forward to speaking to you more. Thank you. Bye bye.
Always.